Hey guys, April here. Coming at you day 4 post-op from VSG. Um, I consider this day 4 because I consider the day that I had my surgery day 1 because I had it very early in the morning. So that was day 1 for me. So that's why this is day 4. But I did have my surgery August 9th at 7:30 a.m. I realized that I hadn't given you any stats at all. Probably since last week sometime. So I guess I can go ahead and give you those really quickly. I know that's what a lot of people are interested in. So I'll go ahead and give you some stats. I started out the day I started my pre-op diet, I was 306.0. The day that I had my surgery, I was 294.4. When I came home from the hospital, of course, I weighed myself out of curiosity to see how much I had gained from fluid, and I was 298.0. But when I weighed myself this morning, I was 290.6. So that is a total weight loss of 15.4 pounds in a little less than 2 weeks, I guess. So that's great. I wish I was a little hungrier. Actually, I've seen people say their stomachs are growling and they're so hungry, and I do not feel that way at all. Not a bad thing, but at the same time, it makes it hard to get my protein and all my water in. So far I've only been able to get in about 34 ounces of water and 28 grams of protein, and that was yesterday because that was my first full day home from the hospital, and because I just started the liquids on Wednesday. Today I've already had 4 ounces of protein because it's still fairly early. It's 8:17 in the morning, and I am about this far into my water bottle. I'm waiting on my 30 minutes for my protein so I can start drinking my water again. I'm just kind of going by this little template they gave us with the packet initially and hoping that I'm doing this right. I just want to make sure that I stay hydrated because that's definitely my main goal. So anyway, feeling better today. Slept pretty good last night. I'm pretty sure I slept for, I would say, at least 4 or 5 hours straight, which is good anytime for me because typically I wake up, I'm a light sleeper, I have to go pee, or if my eyes do open, I get up to go pee because my body's like, hey, go pee. So I have that left over from when I was pregnant, which was 3 years ago, and it just never really went away, along with my pregnancy nose, which is so much worse now. I can smell everything so strong, everything. My husband got out of the shower last night. I was like, dude, your soap smell is really strong. Normally I like it, but actually I think it was beard oil, not soap. That must have been what it was because it has like a weird, manly scent, I guess. So I thought that I would take a little time. I know my videos are typically short, but just in case you're curious of how my surgical experience actually went and my anxiety and things of that nature, because I know that I had addressed that being a concern for me, I thought that I would go ahead and talk about that. And I apologize. I'm in my recliner, so I'm just like rocking inadvertently. I'll try not to do that. I don't want it to make you seasick. So if that does happen, sorry. I just can't really help it. I'm just sort of doing it. Okay, so anyway, day of surgery. Of course, I got like 2 hours of sleep. And, that's not really any surprise. I'm surprised I got that much because just the anxiety and the nerves. And I got up at 3:30, took a shower, got dressed. We headed to the hospital. Of course, we had to go through Whataburger first. For those of you who aren't in the South and don't know what Whataburger is, it's 24-hour burger joints. And my husband had to get him some taquitos, which really didn't bother me because I was too nervous and nauseated because of the nerves to really be hungry. So we got to the hospital. I got checked in. I had to wait a little bit because the pre-op rooms in the same day surgery, which is where they take us, were not ready. And it was just like this little holding room with like a little, curtain that you pulled closed. And so I was in there for a while. That was where they weighed me. They got me into a gown and they put my IV in. And I was actually really calm. I was cool. I was dealing pretty well until the first nurse that tried to do my IV, she blew my vein, as you can see. I'm wearing my Fitbit on this arm, which is my dominant arm, just because I had an IV in this other one for a really long time, and there's a little bit of a knot, and it's still pretty tender, so that's all. Anyway, so that's what I got going on there so far. There's some bruising under here you can't really see because of that. For some reason, that totally freaked me out. I cried a little bit. It was, ridiculous, but that was the first thing that really kicked my anxiety up. So then this other lady comes back, and she was able to get an IV right here. You can't really tell because this is a weird angle. Okay, so like right here in the side of my arm. Not a great place, but at the time I didn't give a shit. I was like, hey, as long as you get it in the vein, you don't blow it so that I can get my, my fluids and my meds and everything. I'm cool with it. So that was good. We got that done. I was all right. So we chilled in there for just a little bit, and then they took us to another, pre-op holding room. So we go into this. It's another little room. Nothing going on in there. That's where the doctor came in and talked to me. He asked me how much weight I lost, which, if you're wondering, when I weighed myself, which I did give you the stats, but it was 11.6 pounds from the start to the day of surgery. So I told him that, and he was like, that's great. And he came in and talked to me, and then the anesthesiologist came in and talked to me, had me sign the consents, told me what was going on, what I was going to do. And, I did advise him that I do suffer from some anxiety, and he said, that's cool. We got some medicine for you. He was an older man, but there was like an anesthesiologist technologist. I'm not sure if they have something like that. It's like an assistant. Anyway, he was, I think maybe a nurse assistant. His name was Dan, and he was really cool. He was the one that actually came and got me and took me back. Now, there was a little bit of delay because my doctor was assisting in an emergency surgery with another doctor. Not much of a delay, but a little bit. But, I wasn't in any hurry to get over there and get that done, so I didn't really care. So I go in, and, he said, I got some Versed for you, which was what they were going to give me for my nerves. And he said, I don't want to give it to you just yet because we still need you talking to us, and we need your assistance getting onto the operating table. And I was like, all right, cool. And so I go in there, and they're like, all right, move over. And all of a sudden, I just felt this weird, lightheaded, groggy sensation. And I was like, did you already give me that medicine? And he was like, yeah. And I said, well, you're sneaky. That's what I said, because I never even knew that he gave it to me, which was fine. That lessened my anxiety about worrying how the medication was going to affect me. I remember moving over onto the table. I remember talking to them. I remember there was I don't know if she was a surgical nurse, if she was a scrub tech. There was a lady over here on this side of me. And I remember her telling me that she liked, I have a tattoo on my foot. I'll have a tattoo on both foot. On my left foot, I remember her saying, oh, I like your tattoo. And then her saying, oh, I like your shoulder tattoo also. I remember that. And then I told her, thank you. And I remember telling them that I was going to school to be a scrub tech, which is someone who works in the OR. And they were like, oh, that's great because we need more. And I remember telling them this story about when I had my C-section and how I had on a horrible bra and my boobs were like smothering me, and I asked the anesthesiologist if he could strap them down, and he told me no, and they all started laughing at me. And we were kind of joking around, and then I think they put oxygen on me, and really I don't remember anything else. Next thing I remember is waking up in recovery and being like, because I felt like I had a lot of weight on my chest from the gas, and I remember just trying to burp, and it was the weirdest sensation because it was like half of the burp would come out, and then half was like stuck right here. And so the lady, the RN who was there, she was like, just try to cough, and that might help. So I was trying to cough. I never went back to sleep from the time that I woke up from anesthesia, sorry, until I don't know, midnight or something that night. I fell asleep briefly. I was awake the whole time. I was still very groggy, but I could not sleep. I would just lay there with my eyes closed, but I was still completely aware of everything that was going on around me. They took me back to my room. They moved me over into this bed, which at the time I thought was comfortable. This like lady blew it up. It did all this stuff. But, I was still really doped up and groggy from the anesthesia. And that was probably around 9:30, 10 maybe that morning. I remember asking, what time is it in recovery? And the one time I've ever been put out for anesthesia, that was the first thing I said then too, is what time is it? Because some part of my mind says, I know that if it's been a long time between the time that I went in and now, that some sort of complication arose or something happened. So I guess I just like, what time is it? So they take me in my room, they get me moved over. I'm all right, as far as I can remember. And like I said, I just laid there for a little while, and I, uh, I guess it was around noon. I called the nurse and I said, "Hey, I think I'm ready to get up." And they're like, "Oh, okay." So I get up, real slowly. She moves the bed, deflates it, and everything, and I get down and hobble to the bathroom, and I was able to use the bathroom. And then I get back up, and I just sort of walked around the room a little bit, and I was like, okay. So I sat back down, laid down for a little while, and then my mom and my husband were there, and my dad, my mom and dad, and my husband were all there. That morning before I came in, my husband was with me before I went in for surgery, and then my dad, he showed up, a little while before he was able to get there before and spend some time with us. So that was good. I did have some family there, and they're all really supportive, and they were helping me out as much as they could. So yeah, anyway, I decided at some point that I wanted to start walking around, and I did. And I walked several laps, and they were like, "Are you," they asked me, "Are you so and so?" And I was like, "Yeah." And the nurses were like, "You're doing really good." And I'm like, Okay. I just knew from everything that I had read and researched and watched that walking was the most important thing, that because I had so much gas pain, my back hurt so bad. So bad. That to me was worse than anything else, because no position that I could get in was comfortable. I couldn't, because I laid on my sides. I've slept on my sides pretty much from the beginning, because my large incision is in the middle above my belly button. It's not to the left like a lot of people's are. My doctor actually does it, and I only have five because I didn't have the drain, and they all look really good. And maybe I'll show them to you sometime, but not today because I don't even have a bra on or anything, and I'm just not feeling like dealing with that. So anyhow, I got up, walked around for a little while, and then I would go back, and then I would get up, and I did that throughout the day. And they kept telling, they asked me, "Have you used the bathroom?" And I'm like, "Yeah." And they're like, "Hey, you just do everything without being asked to do it." And I'm like, "Hey, I'm trying to make this easier on myself." And they're like, "Well, you're such a good surgery patient. You don't even have to be asked." I know I said that in the one video, but that's where that came from. My nurse that day, which of course they were 12-hour shifts, so they switched out at 7 a.m. and 7 p.m. every day. But the first lady, she was really impressed. Um, anyway, so the first day was pretty good. I felt all right. They came in to give me some morphine. I think I asked for it around 9 or 10 that evening, because I hadn't had any. I had 2 milligrams of morphine, and that is all that I had had. And it didn't do anything. I didn't notice any difference. So I had asked, because they told me I could have up to 4 milligrams, and I didn't want that. So I said, just give me the low dose. So then after the 2 milligrams didn't do anything, I said, all right, let's try the 4 milligrams. So they gave me the 4 milligrams, and instantly I like tensed up. My legs felt like they just started hurting and cramping, and my stomach cramped in waves. If any of you have ever had a baby where you were induced and they gave you Pitocin, it was like that. Not as intense as labor pains, but it came in waves, and that lasted probably a minute. It was really uncomfortable. I did not like it. And so after, and it still didn't do anything for my pain. So I was like, I'm not going to do the morphine anymore. But so this bed that I thought was great initially because I was doped up, I start to realize is not. Like, seriously, it's an air bed, and it has rows of, air things, whatever. I can't think right now. So they blow up, and it's like this down the bed, which is very uncomfortable. even fully inflated, because you have these, you're laying on these like lumpy air pillow things. And half of the bed was much more inflated than the other half. So it was like this. Not cool. So I finally, around midnight, I unplugged my IV. There's a chair in there that reclines, which I can't figure out how to recline the damn thing. So the nurse comes in and she decides, and she helps me. She helps me do that. So I get in the recliner, lay in there, and I was able to sleep eventually, maybe 2 hours. I think I woke up around 2:30 or 3. I know around 4 o'clock I lost my shit because I was in so much pain. My back hurts so bad. I was like sobbing, just like, I mean, there's nobody in here but me, right? Like who, but I called my husband at like 5:50 in the morning because I know he gets up at around 6. So I called him and I was just crying and I'm like, I wish you didn't have to work today. And he was like, I can take off. And I'm like, no, you can't afford to take off because he doesn't have any vacation time. We've already used it all. And anyway, about that time my dad came in, thankfully, because he goes to work really early in the morning, and he just came in to check on me. He thought that I was going to be asleep, and I was not asleep. I was just sitting there sobbing like a child. The nurse, she had come in around that time too, the same time as my dad, around that same time, I guess, to just check on me. And they gave me a Tylenol drip, which was like 1,000 milligrams. I got 3 of those. Those are pretty expensive, so I'm really glad I have insurance. So anyway, she gave me some Reglan, which is supposed to help with gas and acid and everything. I never noticed a real difference, but I told my dad, I was like, let me go ahead and just get up. Maybe if I walk around, it'll help a little bit. So I got up and I walked around a little bit. And I came back and I just lay down in the chair. And I was so tired and so sleepy. I would just lay there. And of course, about the entire time I was in the hospital, any time that I would doze off or get really comfortable and feel like I was about to doze off, the freaking IV thing would start going off saying there was air in the line, which totally freaked me out the first time because I'm like, air in the line, if I get an air bubble in my veins, that's gonna kill me. And or somebody would come in there to check my vitals. I'm a very light sleeper, so I had my headphones in listening to like thunderstorm meditation type stuff, and I had like an eye mask on, but still, I still wake up, and I was just so irritated at this point. I was about, ugh. So the doctor came in about 8:30. He asked me how I was doing. Told him about the back pain. He did some blood tests because he did want to rule out that it wasn't anything other. He said that was very common, that with this type of surgery, a lot of people experience that. So that was okay. And they did some blood tests. Nothing was really out of the ordinary. I had a liver enzyme that was just slightly elevated, but other than that, everything was normal. So I guess they weren't worried about that. He told me he would be back in a little while. Never saw him again for the rest of the day. Finally, around 4, my nurse called to find out if he wanted to discharge me or not, and he did say I was good for discharge. So I got out of the hospital about 6 that night and came home, and that was just a little bit before I made that one video where I forgot to even turn my phone, and it's like the typical iPhone video. And so you were able to see what crap I felt like. So yeah, I guess that is my total experience so far. Everything's been pretty good. I still can't say about a full feeling because, like I said, my stomach it sort of hurts all the time. It's just, I don't know if it's because it's empty, because when my stomach's really empty in the past, it would hurt also. I did get down a little bit more protein this morning. I've already had about 10 grams of protein, and I might have already said that. Anyway, and I'm trying to get my water down now, and I'll try some more protein in a little while. But I just thought I feel better in the mornings, and I have more energy. So I thought while I was feeling better, finally got me a shower, I'd make a little video, and I wanted to tell you guys about my actual experience and how I dealt with it with my anxiety and everything. So I was really surprised. It went much better, much smoother than I expected. I do get these really bad gas pains in my stomach. I've seen some people say that everything feels like it's here, and maybe that will be my full feeling later. But right now, it's like rolling gas pains sometimes, and I just have to kind of like arch my back. Sometimes if I put my head back, you can hear it's like all these esophagus sounds. I'm pretty sure that's normal from everything that I've read and seen. So, guys, I apologize for the long video. I just wanted to tell you about everything so far, get you some updated information. I probably after this week, probably just going to do weekly videos, you know, unless something crazy happens or I have some cool NSVs or anything like that. I will probably just let you know how I'm progressing from week to week. I mean, I'm really happy to have lost 15 pounds, but quite honestly, I feel like crap. So the weight loss at this point just kind of takes a back seat to just feeling better in general and being able to get down the things that I need to get down, because I wanted to have a good restriction but not an over restriction, so that I can still get sustenance in, you know, with it. Thankfully I haven't been sick. I'm really thankful about that. I did, like I said previously, I did dry heave twice the day that I started taking liquids, and both times were after this. They brought me this sickeningly sweet chocolate protein shake, which was like a boost glucose control shake, which is what they have in the hospital. And it tasted good. Like, it was really chocolatey, but I drank an ounce of it and I was okay. And then I don't know. I drank a little bit of water. I was laying back and all of a sudden my mom was in there and I was just like, give me the bucket, give me the bucket. And she can't hardly hear what I'm saying half the time. She can't. And so she's like, I thought I was going to throw up, but I didn't. I just dry heaved, which was so painful. Oh, it hurt so bad. It felt like my insides were just bucking themselves. And then that happened once again. I got up to go pee, and as soon as I sat on the toilet, that started happening again. Thankfully, that is the only 2 times I have experienced that. I do carry my little bucket around with me. It hasn't had anything in it yet, but I do carry it wherever I go, like where I'm going to sit for a while, because just in case. All right, guys. Well, I guess that is it for today. I will try to hit you up tomorrow, sometime in the next few days if I don't get a chance. It's the weekend, so my husband and my kid will be here, so I may not have the opportunity to make a video the next 2 days. But I'll try, especially if anything happens. Maybe at some point I'm hoping to put on some actual regular clothes and maybe go somewhere. I'm not allowed to drive until next week, which I have to go back to work on Wednesday, which is the day that I'm allowed to drive. So I guess that works out. Hopefully I'll feel better by then. So that's it for now. Keep up the good work, everybody that was recently sleeved, and all of you guys that are pre-op. I know that that liquid diet is tough. Everything's tough, I promise. And I'm probably not the most objective person right now, because I'm in buyer's remorse simply because I'm like, why the hell did I do this to myself? Not because I can't eat. Like, I don't give a shit about not being able to eat. That doesn't bother me at all. It's more just like, I feel weird, I'm anxious, you know, that kind of stuff. So I can't be objective about it right now, but I'm still cheering everybody on. I'm not in any way saying don't do it at all. I know this will pass. So I will talk to you guys next time. Have a great day. Bye.